Have you been constipated and reached out for Dulcolax without actually knowing how it works? Do you know that taking Dulcolax wrongly can cause stomach cramps or diarrhea or even worsen constipation over time? I guess you don't know. In this video, I will explain everything you need to know about Dulcolax, how it works, when to use it, when not to use it, who should avoid it, possible side effects, and common mistake people make. Let's get started. Hello everyone, welcome back to this channel. If you are new on this channel, my name is Pharmacist Ezekiel, and I am keen on bringing to your screen health and medicine information and tips. They are evidence-based, so please, if you are here to subscribe to this channel, I implore you to subscribe, put on the notification button, and so that whenever I upload a new video, you'll be first to know. And if you're watching on TikTok, Facebook, Instagram, on X, do where to follow. Thank you. Let's go right into the video. What is Dulcolax? Dulcolax is the brand name for Bisacodyl. It belongs to a group of medicine called stimulant laxatives. Unlike other fiber supplements that soften the stool, Dulcolax works by stimulating the muscles in the large intestine. This helps move stool through the bowel, and also there will be an attraction of water into the intestine, which will help the stool to come out without any friction. And it is mainly used in occasional constipation, and it's also used to clear the bowel before surgery, or what we call colonoscopy. Is a test that is done to ascertain whether someone has colon cancer. You may be asking, how fast does Dulcolax work? How long does it take to relieve someone of constipation? Well, it may depend on the particular dosage form you are taking. Maybe you are taking the tablet form of Dulcolax, or maybe you are taking the insert form of Dulcolax, depending. Each of them have specific or average time in which the work can start in your body to relieve you of constipation. So if you are taking a tablet form, it normally takes 6 to 12 hours before you start feeling the impact. That is why it's being recommended or prescribed to patients to take it at night before sleep, so that while they wake up in the morning, they can be able to pass to or go to toilet freely without struggle. But if you are taking the suppository, that's the one they insert into the bone or into your buttocks, as the case may be, that one takes 10 to 16 minutes for it to act. So that's why I say depend on the dosage form that you are taking. As a pharmacist, I want to tell you how to take Dulcolax without having issues or without having too much of the side effect. Number one, swallow it whole with water, not with milk, not with antacid, not with any other thing, with water. This will enable it go down into your stomach and enable it to take its time to dissolve and begin to act. Because if you take it with milk or antacid, you may likely uncover the coating of the drug early, and it may increase the tendency for stomach irritation. Do not crush it or break it before taking it, or chew it, as the case may be. Swallow it with water. And remember, Dulcolax is used occasionally. So if you are always having constipation, I will advise you, in fact, I will recommend you go see a doctor for proper evaluation. There can be an underlying issue causing consistent constipation. Because if you continue to use Dulcolax, your bowel will become dependent to it, and it will get to a point that anytime you don't take it, you will not pass through. Are you seeing it now? So if you are having consistent constipation and you have taken the drug for the required period of time and there's no improvement, please see your doctor to complain, so that any other investigation can be carried out to ascertain if there is any underlying health issue causing the consistent constipation. What are the common side effects of Dulcolax? Like other drugs have side effects. For Dulcolax, it can cause stomach cramps, it can cause abdominal discomfort, it can cause nausea, it can cause diarrhea, it can also cause bloating, where your stomach, you are always feeling full. There is much, as if there is much gas or something. So it can cause bloating. And if diarrhea becomes severe, you can become dehydrated and lose most important electrolyte like potassium. That is why you need to ensure that you are not self-medicating with Dulcolax. Who should not take Dulcolax? Number one, if you are having consistent stomach or abdominal discomfort, stomach cramps, please see your doctor before you take this drug. Number two, if you are having persistent vomiting, you are not supposed to take this drug. Number three, if there is suspected bowel obstruction, you are not permitted to take this drug. Number four is severe dehydration. That means you are dehydrated, you are low on electrolytes, you are low, because Dulcolax have a way of drawing water into your intestine. If you are dehydrated, the side effects can be aggravated. Number five, rectal bleeding. If you are bleeding from your anus, please don't take this medication yet until you are clarified to take it by your doctor. Very important. And number six, if there is a sudden bowel change or the sudden habit in the way you visit the toilet, the way you poo, you pass your stool, and this bowel change lasts up to 2 weeks, please, you are not supposed to take this drug until your doctor ascertains the source of that bowel change. Dulcolax can interact with other drugs like diuretics like furosemide, hydrochlorothiazide, especially if you are hypertensive and you are taking some of all these drugs like spironolactone. It can also interact with indapamide, diuretics, and other diuretics can interact with this drug, so you have to be careful. And number two, if you are taking corticosteroids, prednisolone, dexamethasone, and other corticosteroids tablets, they can react with this drug. And number three, if you are taking other laxatives, laxatives are like a group of medicine that enable you to pass stool easily. So these drugs can interact with each other and cause greater side effect if you don't take care. When should you see a doctor? You should consider seeing a doctor if number one, your constipation has lasted more than 7 days. If your constipation has lasted for more than 7 days, please see your doctor immediately. Number two, if you notice blood in your stool, please see your doctor immediately. Number three, if you lose weight without trying, very important, please see your doctor. Number four, or if you have persistent or consistent stomach cramps or stomach abdominal discomfort, please, this might be a sign of a serious issue that if detected early can save your life. See your doctor too. Number five, if constipation keeps coming back, you stop today, after some time it comes back, after some time it comes back, please see your doctor. As a pharmacist, I will not leave you without giving you health tips to prevent constipation, because the drug in question helps to relieve constipation. So there are some practices that can help you prevent constipation. Number one, which is the most common, drink enough water. Very important. Dehydration can cause constipation. Drink enough water daily. Number two, eat more fruits, whole grain, and vegetables. Some of you like to eat all these white bread, eat things that will donut and all these carbs and all of that. Some of you can stay on those things for days without eating good food. So minimize the intake of carbs and increase your intake of fruits, whole grains, and vegetables. Number three, stay physically active. Don't just sit down one place. We call it sedentary kind of a lifestyle. No, don't just sit down one place. You're always indoors, sitting down, lying down. No. Be physically active. It helps the bowel movement. It helps movement of food and digested food in your intestine. Number four, don't ignore the urge to visit the toilet. Don't ignore it. Some of you are masters in holding your stool. You can hold your stool for more than 2 days. That is wrong. That is wrong. Please ensure that you visit the toilet when you have the urge to do. When the urge comes, take advantage of the restroom to ease yourself. In conclusion, Dulcolax is a very good medicine for the relief of constipation within the shortest possible time, especially when used correctly. However, you should not rely on Dulcolax, especially when the constipation is persistent and consistent. It can be a sign of a greater health issue, which must be evaluated by your doctor before you continue with Dulcolax if need be. And if you found this video helpful, please give me a thumbs up, like this video, subscribe, share to your friends so that they will learn and be health informed concerning their body and the drugs and the medicine they consume per day. Till I see you next time, stay healthy. Thank you.